We first, in the previous chapter, in the previous lecture, we have discussed the celluloplasmin of the alpha 2 globulins. Now we'll discuss the second types, the haptoglobin, and the types of beta 1 globulins. Just now I have said we have discussed the first type, celluloplasmin of alpha 2 globulin. Now we'll discuss the second type, haptoglobin. What is haptoglobin? It is composed of two kinds of polypeptide chain, two alpha chains and the two beta chains. Site of formation, it is synthesized in the liver by the hepatocyte, and to very small extent it is synthesized in the reticuloendothelial cells. Here you can see the two alpha and the two beta chains, and these are connected together by the disulfide bond. It is synthesized in the liver, and this you can see the structure of the haptoglobin. What is the function of haptoglobin? Actually, hemoglobin, when it decomposes, or the myoglobin and the cytochrome, the other heme proteins, they release iron. And the normal pathway is that, I'm talking about the normal pathway. The haptoglobin or the hemopexin, it combines with the hemoglobin, whereas the hemopexin, it combines with the heme. And in this way, the normal metabolic pathway takes place. The hemopexin, it will discuss it in the next chapter. So, it is taken up by the hepatic cells. Heme is taken up by the hepatic cell, this complex, heme-hemopexin complex. Whereas, there is another process also, which is also normal, that heme, by the heme oxygenase, it is converted to carbon monoxide, biliverdin is converted to bilirubin, and the iron, it is stored in the form of ferritin, and the iron is then transferred by the transferrin, and the recycling of the iron takes place. So what we get from this slide, that the haptoglobin, it binds the hemoglobin. Haptoglobin increased with a mean age concentration of 0.02 gram per liter at birth to adult level within the first year of life. As old age approaches, haptoglobin level increases. More marked increase is seen in the males. Functions of haptoglobin. As I have just shown, that the function of haptoglobin is to bind free hemoglobin from lysed cells. By its alpha chain, it binds with its alpha chain to the free hemoglobin, which is released from the cells, and minimizes the urinary loss of globulin. Abnormal hemoglobin, such as Bart's hemoglobin or hemoglobin H, have no alpha chains, and hence they cannot bound the haptoglobin. Average binding capacity of haptoglobin is approximately 100 milligrams per dl. So, that is binding capacity to hemoglobin 100 milligrams per dl of haptoglobin binds. So, in this way you can see that what we have learned from this slide, that haptoglobin, it binds with the free hemoglobin, and in this way it prevents the urinary loss of hemoglobin. Whereas the two forms of the hemoglobin, we do not have the H chains, we do not have the alpha chains, they cannot bind with the haptoglobin. So, how the haptoglobin binds to hemoglobin? Through the H chains, through the alpha chains of the hemoglobin. After binding, this complex, hemoglobin complex, circulate in the blood, which cannot pass through the glomerular filter, and ultimately the complex is destroyed by the reticuloendothelial cells. You know that hemoglobin is not filtered through the glomerulus due to the formation of this type of complex. Haptoglobin level become depleted in the presence of large amount of free hemoglobin because it is combining with the hemoglobin. Therefore, decreased haptoglobin is a marker of hemolysis. Hemolysis means large amount of the hemoglobin is released. And since the haptoglobin is not sufficient, is not present in the sufficient amount to bind that hemoglobin, therefore, if you estimate the level of the haptoglobin, you will get a decreased value. This can also occur in mismatched blood transfusion reactions and in hemolytic disease of the newborn. Serum haptoglobin concentration is found to be increased in inflammatory conditions. It exerts an anti-inflammatory activity, and that by the degree with which it reduces the inflammatory process by the production of interleukin 6, which have the anti-inflammatory effect. So what is the effect? How it is considered as anti-inflammatory, or what is its role as anti-inflammatory? It produces interleukin 6 cytokine, and these cytokines have anti-inflammatory effect. Okay? So it exerts an anti-inflammatory activity, and that by the degree with which it produces the interleukin 6, and interleukin 6, it reduces the inflammatory process. The more the haptoglobin, the more will be the anti-inflammatory activity and more will be the production of the interleukin 6. Or you can say the more haptoglobin, the more will be the production of interleukin 6 and more will be the anti-inflammatory activity. Now we come to the beta globulins, are a group of globular glycoproteins in plasma. Alpha and beta globulins are transport proteins. They transport lipid, carbohydrate and vitamins. They serve as a substrate for the formation of other important compounds. In these compounds, they perform the different functions in the body. There are various types of beta-1 globulins: beta-lipoprotein, transferrin, C-reactive protein, hemopexin, complement, C1q. These beta-lipoproteins or the lipoproteins we will discuss in the CVD module, cardiovascular module, and therefore I am not discussing it here. There are 4 types: high density lipoprotein, low density lipoprotein, very low density lipoprotein, chylomicron. There are 4 types of the lipoprotein, but we will discuss it in the CVS module. Now we come to the transferrin. Transferrin is a non-heme iron containing protein, and formally it is called as siderophylline. It consists in plasma. It consists as beta-1 globulin, a glycoprotein having a molecular weight of 70,000 approximately. And it is a true carrier of iron. In the iron metabolism, just recall transferrin, it transport iron in which form? Ferric form. Ceruloplasmin, which we have discussed in the last lecture, it oxidizes iron from the ferrous form to the ferric form, and then transferrin, it transfers that iron through the cell to the tissue cells having the transferrin receptors. If you just recall your iron metabolism lecture. Protein part is known as apotransferrin. Apo, that is the protein part, and then iron is there. Iron is combined, and then the transferrin is formed. So the protein containing iron is called transferrin. It is a single chain polypeptide, protein है, polypeptide होगा, and can bind two atoms of iron to form transferrin. Concentration of transferrin is 1.8 to 2.7 grams per liter with the average of 2.3 grams per liter. It has capacity to bind 3.4 milligrams of iron per liter or 1.46 milligram of ferric form of iron per gram of transferrin. These are the factors. इनको रट्टा लगाना है या लिख लो. For the MCQ point of view, they are important. Normally, transferrin is 33% saturated with iron. Synthesis कहाँ होती है? The protein transferrin is synthesized in the liver. Remember one thing, all the important proteins and all the things are basically they are synthesized in liver. There is also evidence of its synthesis in bone marrow क्योंकि वहाँ synthesis हो रही होती है RBCs की, spleen, lymph nodes, perhaps by the lymphocytes. Function of transferrin. Only function is to transport iron between the intestine and site of hemoglobin synthesis and other iron containing protein. And you know that transferrin, it transports iron in the ferric form. It also has seen that unsaturated transferrin has a bacteriostatic function. क्यों? इसलिए कि वो बैक्टीरिया में से आयरन को स्क्वीज कर लेता है. It squeezes iron from the bacteria and in this way the bacteria dies. Increased levels are seen in iron deficiency anemia and in the last months of pregnancy because iron is not present in the required. Decreased conditions like malnutrition, cirrhosis of liver because this protein is synthesized in the liver, nephrotic syndrome, acute illness such as trauma, myocardial infarction, then the decreased levels are found. Then we come to the third protein which is known as a C-reactive protein. It is a beta globulin, right? So C-reactive protein is synthesized in the liver, hepatocytes, but also, तो पहला क्या था यार? पहला था haptoglobin, then the transferrin, and the third is a C-reactive protein. इसको बहुत गौर से लेक्चर को सुनना. It's a bit difficult. It is a beta globulin. C-reactive protein is synthesized in the liver hepatocytes, but also by smooth muscle cells, macrophages, endothelial cells, lymphocyte, and the adipocyte. Adipocyte, that is the cells of the adipose tissue. It is present in concentration less than 1 milligram per 100 ml in adult male. हो गया यहाँ तक? ठीक है? Functions पे आते हैं. Now be careful. Function. Inflammatory process. It is very sensitive indicator of early phase of an inflammatory process and produce acute phase response. अब क्या होती है ये acute phase response? Plays important role in inflammatory processes and host response to infection. यानी suppose करो मुझे infection हो जाए तो how I respond to that inflammation. It remains increased in the presence of solid tumors but not in conditions which impair immune response such as leukemia, Hodgkin disease, etc. So it plays an इस स्लाइड से देखो हम स्लाइड बाय स्लाइड जाएंगे. I will go very slow and remain with me during the lecture. So it is a very sensitive indicator of the early phase of an inflammatory process and produces acute phase response. Plays important role. बस इससे यार ये याद रख लेना कि it plays important role in inflammatory processes. We'll see in the next slide. And host response to infection. It remains increased in the presence of solid tumors because in tumors inflammation is there. Mostly tumors are associated with necrosis and inflammation. Acute phase response. C-reactive protein binds to the phosphocholine. Lipid पढ़ा है ना? Choline याद है? Phosphocholine. Expressed on the surface of the dead or dying cells and some bacteria. Inflammation है, cells की death है, या dying cells हैं और some bacteria है जिन्होंने आपकी skin को या किसी भी part को infect किया है, and the inflammation is there. ठीक है? So CRP binds to the phosphocholine expressed on the surface of the dead or dying cells and some bacteria. So when this CRP, वो जो सेल मर रहे हैं, जो खराब हो चुके हैं या बैक्टीरिया है, उनकी सरफेस पे क्या हो जाता है? फॉस्फोकोलिन एक्सप्रेस होता है एंड CRP उस फॉस्फोकोलिन के साथ बाइंड करता है. This binding, it activates the complement pathway. ठीक है? What is the complement pathway? The complement system is a part of the immune system, right? And this system, it enhances the ability of the antibodies and macrophages to phagocytize cells. जो खराब सेल्स हैं उनको खा लें, एंटीबॉडीज बैक्टीरिया के साथ रिएक्ट करें, मैक्रोफेजेस इनगल्फ कर लें सेल्स को, फेगोसिटाइज कर लें एंड क्लियर कर दें नेक्रोटिक एंड एपोप्टोटिक सेल्स एंड बैक्टीरिया. किसको क्लियर करें? नेक्रोटिक, सड़े हुए सेल्स को जिनमें इन्फ्लेमेशन हो रही है, रेडनेस हो रही है, कोई पस निकल रहा है. एपोप्टोटिक सेल्स जो कि ऑलरेडी डेथ हो चुके, कचरा पड़ा हुआ है, उसकी सफाई करें. And the bacteria which are invading, and this is called the acute phase response. तो acute phase response क्या होती है? देखो बहुत आसान है. Any dying or dead cell या bacteria which has to be removed from your body, तो C-reactive proteins उसके साथ उन cells के ऊपर जो phosphocholine होता है उसके साथ bind. When this CRP, it binds the phosphocholine, then it activates the complement pathway. So when this complement system is activated, then the ability of the antibodies and macrophages to phagocytize the cell, उन cells को हड़प करना, उनको clear करना, it is increased. एंटीबॉडीज की एक्टिविटी इंक्रीज हो जाती है टू फॉर्म द कॉम्प्लेक्स विद द एंटीजन एंड द मैक्रोफेजेस. Their ability is increased to phagocytize the cells and clear the necrotic and apoptotic cells. Necrotic cells and apoptotic cells, ये सारे कचरा है, ठीक है, जिनकी डेथ हो चुकी है. अब उनको वहां तो पड़ा नहीं रहने देंगे ना, सो क्लियर करना है. And this is known as the acute phase response. So what is the acute phase response? When CRP binds with phosphocholine, activates the complement pathway. Complement pathway, it activates the antibodies, increase the ability of the antibodies to bind with the antigen, bacteria, and the macrophages activity or ability is also increased to phagocytize the cells and clear the necrotic and the apoptotic cells. Interleukin 6. Acute phase response occur as a result of increasing concentration of the interleukin 6. Interleukin 6 भी produce होता है, ठीक है. which is produced by the macrophages as well as adipocyte in response to the acute and chronic inflammatory response. तो देखो कितनी अच्छी बात हो रही है, यानी इंटरल्यूकिन 6 भी प्रोड्यूस होता है, मैक्रोफेजेस प्रोड्यूस करते हैं, दे ऑल्सो हैव एंटी इन्फ्लेमेटरी एक्टिविटी। और ये कहाँ से प्रोड्यूस होता है? मैक्रोफेजेस से प्रोड्यूस होता है और एडिपोसाइट से प्रोड्यूस होता है। Condition causing the release of interleukin 6 are bacterial, viral and fungal infections. It has the, remember one thing, interleukin 6 has anti-inflammatory activity. Rheumatic and other inflammatory diseases, malignancy, tissue injury, necrosis. These conditions cause the release of interleukin 6 and other cytokines that trigger the synthesis of CRP and fibrogen by the liver. अच्छा, अब देखो, अब कहानी कुछ इस तरह हो गई कि ये जब कोई भी इन्फ्लेमेशन होती है तो इन्फ्लेमेशन रिलीज करती है इंटरल्यूकिन 6 को, and when the interleukin 6 which is anti-inflammatory ये जब रिलीज होते हैं, they trigger the synthesis of C-reactive protein, and when the C-reactive proteins they are synthesized, then they react with the phosphocholine. When the phosphocholine they react with the phosphocholine, then the complement cascade is activated. When the complement cascade is activated, पीछे की slide देखना, then what happens? That the antibodies are stimulated and the macrophages are stimulated. Phagocytosis is there, and therefore the dead cells, the apoptotic cells, they are clear. Necrotic cells, they are clear. सारा कचरा साफ हो गया। तो सबसे पहले क्या हुआ कि इन्फ्लेमेशन ने interleukin 6 को एक्टिवेट किया, and interleukin 6 then activated the trigger the synthesis of CRP. CRP reacts with the phosphocholine and then the cycle takes place. A role in the formation of opsonin is providing immunity has been proposed. What is opsonin? Opsonin is an antibody or other substance which bind the foreign microorganism or cell and making them more susceptible to phagocytosis. So opsonin भी synthesize होते हैं, ठीक है? Opsonin क्या होते हैं कि just like the antibodies, they react with the antibodies, and or you can say it is an antibody, or antibody, you know what is the work of the antibody? To kill the foreign particle. Reaction with group C polysaccharide of pneumococci. How it reacts, C-reactive protein, how it kills the pneumococci, that is the microorganism cocci which produces pneumonia. We'll see just now. It precipitates with group C polysaccharides of pneumococci. Specific polysaccharide, ये group C polysaccharides क्या है? Specific polysaccharides हैं in the presence of calcium, and hence it is named as C-reactive protein. The pneumono-C polysaccharide is species specific and considered as a wall component of all pneumococci. ठीक है, सी रिएक्टिव प्रोटीन का दूसरा काम क्या है? दे किल द pneumococci. हाउ दे किल द बैक्टीरिया? दे precipitate with group C polysaccharide. And where this group C polysaccharide is present? They are present in the cell wall of the bacteria. So C reactive protein, they react with the C-reactive protein, it reacts with the group C polysaccharide in the presence of calcium, which is present in the cell wall component of the bacteria, and in this way complement is activated and phagocytosis is there. See, this is the structure. अच्छा, once again I remind you, ये जो structures मैं आपको दिखाती हूँ ये इसलिए नहीं होते हैं कि आप इनका रट्टा लगाओ या मैं कभी एग्जाम में दूंगी, just to capture the image. That is how. So you can see the structure. It contains the galactosamine phosphate polymer. Galactosamine phosphate, and it is a polymer, and these polymers are attached in 1,6 linkage. Here you can see the cell wall. This is the outer layer and it is the inner layer. And this layer is made up of layer of C polysaccharide. So C polysaccharide layer is there, and in this way the C-reactive protein, it reacts with the C polysaccharide and the complement is activated, and then the whole cascade of immunity is provided. Antibodies are activated, phagocytosis is there, and the necrotic and the dead cells and the bacteria, they are cleared from the blood. Hemopexin. What is hemopexin? It is synthesized after C-reactive protein. We come to hemopexin. So first was the ceruloplasmin, then the transferrin, then the haptoglobin, and now we are with the hemopexin. You can see the list. I have given 1, 2, 3, 4. It is synthesized by the parenchymal cells of the liver. It is a beta globulin and migrate on the electrophoresis. Molecular weight is this to this. Normal value in adults is 0.5 to 1 gram per liter. It is hemopexin is very low at birth but reaches adult value within the first year of life. Function of hemopexin. The principal function of hemopexin is to bind and remove circulated heme, which is formed in the body from the breakdown of hemoglobin, myoglobin or catalase. Thus protect the body from the oxidative damage that free heme can cause. अभी हम देखेंगे. It binds heme. What is heme? Ferroprotoporphyrin 9. You know it very well. And it also binds several porphyrins in the ratio of 1:1. That is all those porphyrins which contain heme. The hemopexin complex is removed by the parenchymal cells of the liver. The hemopexin complex is removed by the parenchymal cells of the liver. ये देखो, ये hemopexin है. This is heme, right? So in this way it combines with the heme, and the heme is oxidized then by the oxygenases. This is the unwanted heme, जो कि हमें चाहिए नहीं है, which is released by the hemoglobin, by the breakdown of myoglobin, by the breakdown of cytochrome, and by the breakdown of other heme proteins. So in this way carbon monoxide is released, biliverdin is formed, biliverdin is converted to bilirubin, and the iron is released. This iron is either stored in the form of ferritin or it is carried by transferrin and it is recycled. Whereas the hemopexin, it is then taken up by the liver cells and it is removed or catabolized. अभी आपने देखा था ना last slide में जो मैंने आपको बताया था. Yes. The hemopexin complex is removed by the parenchymal cells of the liver. Now, suppose that hemopexin is not present, right? Hemopexin is not present. So, nothing is there. Hemolysis से आप देखो कितना सारा hemoglobin निकल रहा है. It is converted into methemoglobin and metheme is formed. Metheme is formed, right? In this similar way, heme protein, जो जितने भी heme protein है, tissue injury, damage, all the heme proteins are released and they also form the heme. But nothing is there to bind with the heme. So in this way, what the heme will do, it will affect the other cells. Endothelial cell activation, cell death will be there, right? Sickle cell disease will be there. Malaria can cause sepsis, CNS, hemorrhages, atherosclerosis. So you can see that how the hemolysis, if hemopexin is not there, then how the damage can occur, right? Hemopexin here, you can say normally it binds with heme and then the heme is oxidized, and the heme, one way the heme is oxidized and in this way, and otherwise the other way is that heme hemopexin complex, it is taken up by the liver and it is destroyed by the liver cells. But hemopexin is absent. Hemopexin is absent, so heme itself cannot taken up by the liver. So what the extra heme will do? It will produce different types of diseases. Clinical significance: decreased hemopexin level in hemolytic disorders because a large amount of heme is released and therefore the amount of the hemopexin is decreased. At birth in the newborns, increased hemopexin level are found in pregnant mothers because they are the normal functions is going on and the extra amount of heme is discarded by combination with the hemopexin in diabetes mellitus, muscular dystrophy, some malignancies and especially myeloma. Now, in the lecture number 19, we will discuss the complement C1q, beta 2 microglobulins, acute phase proteins, and the interleukin, the function of the interleukin.